In the final section of our lecture, now let's talk about the diagnosis and treatment. In this section, we will discuss the diagnosis of botulism, and also we will talk about the differential diagnosis. What are some conditions that can be confused with botulism and how we can differentiate? What are some features that help us to differentiate between the different conditions? Then the treatment, some expert consultation and antitoxin provision, and then also how we can prevent this condition, which is botulism, because we talked about so many different factors that can lead to the botulism. So how we can prevent, like food canning, and how we can better the procedure so we can prevent the condition. So let's start with the section first, the diagnosis of the botulism. In lone sporadic cases, diagnosis is often missed. So in sporadic cases of botulism, the diagnosis of botulism can be missed. Assessing clinical characteristics, lab confirmation by specific tests, and also some patients have signs and symptoms do not fitting into classic pattern of the botulism. So lone cases, sporadic cases can be missed often. Assessing clinical characteristics can be helpful, but sometimes may not be very specific. Lab confirmation can be done by specific tests used for the diagnosis of botulism. And then also some patients might don't have a characteristic, significant clinical picture that is a characteristic of the botulism. So all these factors will help us in the diagnosis and sometimes mislead the diagnosis. Diagnosis in adults, food history, and names of contacts who may have shared the food. It's important if it's foodborne, if there is a history of consumption of home canned food, whoever were the individuals who consumed the food, and if they are all affected and they have similar correct features or signs and symptoms develop, that's an important part in the diagnosis. Obtained before illness progress to respiratory failure, because respiratory failure can be very serious and even lead to death. Information about consumption of home preserved or exotic foods. History of recent consumption of home canned food. So in adults, all these factors are important and we should ask these questions in the history taking that will help us to lead to the diagnosis. Ascertainment of a patient's behavioral history related to injection drug use. Caretaker's observation up to and including onset of symptoms. So it's important, we should know that if the patient used the injections for the drugs or if there is any caretaker, what their observation is as far as the onset of the symptoms is concerned. History of recent abdominal surgery or antibiotic. Differential diagnosis. Illness commonly considered in differential diagnosis. So what are the different illnesses that can need to be differentiated from the botulism? Guillain-Barré syndrome, GPS, is very important disease that needs to be differentiated. myasthenia gravis, stroke syndromes, Eaton-Lambert syndrome, and tick paralysis. All these conditions cause paralysis, weakness, flaccid paralysis that needs to be differentiated from the botulism. Thorough history and physical examination is very important in the diagnosis. In GPS, we have autoimmune demyelinating polyneuropathy. So there is demyelinating polyneuropathy, multiple nerves are involved, and it's demyelination. Myelin sheath is a protective covering of the nerves. There is loss of that myelin sheath leading to hypersensitivity of the nerve. So it's autoimmune demyelinating polyneuropathy. Present as ascending paralysis. Very important feature between these two. If you we talked about this, that in botulism there is descending paralysis. Paralysis progress from top to the lower part of the body, but in Guillain-Barré syndrome it's from low to top. So it's ascending as compared to descending in the botulism. Case clusters are rare. Occasional GBS cases present as Miller-Fisher variant. Protein levels in cerebrospinal fluid are elevated. CSF findings generally normal in botulism, so that's another differentiating feature. Marginally elevated CSF protein levels reported. Electromyography may differentiate GBS from botulism. Androphonium tensilon test is sometimes of value in distinguishing botulism from myasthenia gravis. Usually this tensilon test is negative in botulism but is positive in myasthenia gravis. Another condition, there is weakness of the muscles and slow paralysis occur. The test that is used for the differentiating between the condition is the tensilon test, which is negative in botulism but it's positive in myasthenia gravis. In most cerebrovascular accidents, strokes, CVAs, physical examination, there is asymmetry of paralysis, not symmetrical, show upper motor neuron signs. Brain imaging reveals rare basilar stroke that produces symmetric bulbar palsies. Eaton-Lambert syndrome manifests as proximal limb weakness in patient already debilitated by cancer. So patient with cancer, they have Eaton-Lambert syndrome, there is proximal limb weakness present. Brain imaging reveals the rare basilar stroke that produce symmetric bulbar palsy. So all these are very important steps in differentiating the common condition. We talked about GBS, we talked about myasthenia gravis, then the stroke syndrome and the Eaton-Lambert syndrome and different CVS. Botulism specific lab tests. What are some lab tests which are helpful in the diagnosis of botulism? We have by demonstration of toxin in clinical specimens or in samples of ingested food. In isolation of toxigenic Clostridia from stool, wound cultures yielding Clostridia. Universally accepted method is mouse bioassay. Requirement vary with the form of botulism suspected. So these are some specific tests, and the most important is isolation of the toxin produced by the Clostridia from the food and from the wound culture. So that's very, very helpful. Clinical specimens submitted for testing, extreme potency of botulinum toxin, new lab test being developed, in suspected wound botulism material from abscess collected in anaerobic culture tubes. Specimen collected more than 7 days after symptom onset. Toxin result may be negative. So time factor is important. More than 7 days usually results are negative. So time period is very important in this. Standard blood work and radiologic studies not useful in diagnosis of botulism. So we have a specific test we can use for the diagnosis of botulism, but the standard test and radiological examination, they are not very helpful in the diagnosis. Nerve conduction studies showing reduced amplitude of motor potentials with or without potentiation by rapid repetitive stimulation in weak muscle and needle electromyogram. So this is nerve conduction studies is an important study. Showing small motor unit action potential consistent with botulism. These results and those that make alternative diagnosis useful. So all these are the specific tests for the diagnosis of botulism. We have nerve conduction studies are important. Tests for the diagnosis of botulinum toxin are very helpful. But other than that, the standard test of the blood and the radiological examination are not very specific for the diagnosis of botulism. Treatment now for the botulism, the cornerstone of treatment for botulism are meticulous intensive care and immediate administration of botulinum antitoxin. So very, very cornerstone of the treatment for botulism is the administration of botulinum or antitoxin. And we went so far, we know that the botulinum toxin is the most common factor or the substance that is causing all the problems associated with the botulism. So the use of antitoxin to destroy that toxin or to deactivate the toxin, to limit the function of the toxin, is the cornerstone of the treatment of botulism. Antitoxin most beneficial early in course of clinical illness. Administered as soon as botulism is suspected, before workup for other illness is complete. So it's very, very important in the beginning, in the early course of treatment, illness, antitoxin is very effective before the workup for other illness is complete. Patients hospitalized immediately with the botulism, detection of respiratory failure, which is very, very common manifestation of botulism. So hospitalization for respiratory management is very important. Antitoxin not reverse existing paralysis. So whatever damage occurs is not reversed by the antitoxin therapy. Botulism, immune globulin intravenously is given. Botulism, antitoxin, heptavalent, and aminoglycosides to be avoided. So, antitoxin cannot reverse the paralysis that is already present. Vital capacity monitored and mechanical ventilation is provided to the patient. Role of penicillin and metronidazole in treatment and decolonization is unclear. Wounds and abscesses in wound botulism, clean, debride, and drain. Debridement of the wound is very, very important part to prevent the infection that can occur later on in the wound or any burn patient. Debridement is very, very important. So, wound cleaning and debridement. And drainage also if there is abscess present. Hypothesize that antimicrobial agents may increase circulating toxin from lysis of bacterial cell. So it's not very effective use of antibiotics or antimicrobial agents because destruction of the microorganism can further aggravate the release of the toxin that is responsible for all the adverse effects. Expert consultation and antitoxin provision. Every botulism case, public health emergency. Antitoxin not universally available. Botulism consultant reviews the case. Coordinate lab confirmation if indicated. Lab testing request must still be authorized. Prevention is very important and no prophylaxis or licensed vaccine is available for the prevention of botulism. Up-to-date canning instructions from reliable source. We mentioned that home canned food can lead to botulism, so it's very important that precautions should be taken while the food is canned and special precautionary measures should be taken. Honey not given to infants. Before, in some areas of the world, it was a tradition to give honey to the newborn babies. Even it is still practiced in some areas or in some countries, but by and large now it is contraindicated. Honey should not be used in the newborn infants. Injection of illicit drugs should be avoided. Wounds to be cleaned properly and completely, and educating individuals or family members of at risk. So it's very important. All these steps are important in the prevention of botulism. Cleaning of the wound, complete debridement, drainage, cleaning, education of the family members who are at risk, proper canning of the food, and then very important, honey should not be given to the infants. So all these preventive measures, we can try to reduce the risk of botulism, and it can be very helpful in the prevention of botulism. Processed food stored properly and heated prior to consumption. Heating of the food is very important, especially the stored food. Proper heating can kill the any spores or microorganism that can be fatal. So that concludes our topic of botulism. Thank you for watching sqadia.com.